welcome to NSC504 Monitoring and Evaluation of Health Programs and Services. We will be discussing monitoring of health programs and services today. In discussing monitoring of health programs and services, in this week, we want to quickly look at 5 objectives. 1. We want to describe monitoring of health programs and services, identify the purpose of monitoring, describe monitoring process, discuss the levels of monitoring, and finally, discuss information required in a monitoring system. Monitoring of health programs and services can be described as usually as the systematic collection of data on specified indicators to inform management and the main stakeholders of an ongoing international federation or national society operation of the extent of progress and achievement of results in the use of allocated funds. Remember, every program has fund attached to it. So when it comes to monitoring, it has to do with collecting specific indicators that are related to that program on the progress and the results that such program has achieved. Monitoring is an ongoing continuous process that requires the collection of data at multiple points throughout the program cycle, including at the beginning to provide a baseline, and can be used to determine its activities, needs, adjustments during the intervention to improve desired outcomes. In another word, it is a continuous process. You cannot start monitoring and just stop it at midway. No, it's what you start doing at the commencement of the program. You do in monitoring, and the reason why you do monitoring at that point is to provide a baseline information. So while the program has started, you continue, you also do monitoring. That is to know if there is any need for you to adjust anything in the process of your intervention to improve your outcome. Remember, every health program has an outcome. You are doing immunization program to prevent certain diseases, either immunization or any of these infectious disease. So every program has an outcome. There is certain outcome you are looking at, and for monitoring of health programs and services, that is why it's being described as a continuous process. It's not something that you say, oh, no, I'm only doing monitoring when the program starts. No, at the beginning of the program, you monitor what you want to do to provide you with baseline information. Monitoring and planning goes together. One of the reasons for monitoring a program or project or intervention is to ensure that programs are implemented as planned and prepare for plan. So for you to conduct monitoring, you must have planning, because the two goes together, and that is why monitoring is sometimes referred to as process evaluation. So you must have plan in place, and when it comes to monitoring, you want to see if what you have said to do in your planning phase has been done. That is why it's called process evaluation, and because it's focused on implementation process. There are questions, about 9 questions that monitoring set to address. Let's look at them one after the other. To what extent are planned activities actually realized? So when you want to conduct monitoring, you have to have the first question as, what are the extent your planned activities realized? Remember, we said that planning and monitoring goes together. Secondly, you also look at what programs are provided, to whom, when, how often, for how long, and in what context. 3. How well has the program been implemented? How much does implementation vary from site to site? What is the quality of the programs provided? Did the program benefit the intended people? At what cost? Is the program making progress towards achieving our objectives? Is the program consistent with each design or implementation plan? And finally, is the program directed towards the specified target groups? So when you have all these plans, when you have all these questions to answer, then you know that you need to set out for monitoring. Purpose of monitoring. One, it helps in setting norms of performance. It helps in measuring the level of performance. It also helps in comparing performance level with standards of norm. And finally, it helps in identifying deviation and explain the reason for the deviation for taking necessary corrective action. So among these four purposes of monitoring, remember we have in our previous slide, we talked about questions that monitoring process set to answer. And by the time you notice any deviation, monitor will help you to see reasons for the deviation and for also for you to be able to take necessary correct. Monitoring process involve four steps. First of all, you remember we said that it's a continuous process. Now the process begin with collecting and analyzing data. The first step in monitoring process is measuring. That is, what are you measuring? The indicators now. Measuring, recording, collecting and analyzing data on actual implementation of the program. You will have had your plan, and the first data you collect is on implementation of the program. Secondly, when you have collected data and you have analyzed the data, you observe if there is any deviation from the plan, and this deviation is communicated to the program managers. After detecting deviation from plan, you diagnose the causes for deviation, because you have a plan before you start implementing. You collect when the implementation started, you have to collect data and you do analysis. You observe there is any deviation. The next thing you do when there is deviation is for you to communicate to your program manager, there are deviation here. And the next thing that you do after detecting the deviation is to diagnose the causes for deviation. The program manager detects the causes for the deviation after analysis, and the last step is for you to take corrective action. Corrective actions are planned and implemented to achieve the desired goals. Then the cycle begin again. That is why it's a continuous process in a program. Levels of monitoring. There are three levels of monitoring. We have manager at the top level. They have to develop health plan based on objectives, goals, devise strategy, and allocate necessary resources. Secondly, we have managers at the middle level. They are more concerned with whether they are getting desired output from the input that are being utilized. We have manager at the operational level. They have to supervise actual operations and to ensure that planned activities are being carried out as per schedule. When you look at these three levels of monitoring, nurses are involved or can be involved at each of the levels. Let's take immunization as an example. At the top level, they work with program the funder of the program. That is those people that fund the program or the internet program, to develop health plan based on what they want to achieve, what the funders want to achieve in that program. So they work with them to come up with a health plan based on that objectives. Then nurses can also work at the middle level, which are more concerned that, oh, they look at what is the output from the input that they have been utilized. So they have put a lot of resources. You talk about campaign to be sure that, oh, people are, the outcome is that they don't want any child from 0 to 5 years to have any polio infection. So this is an example of output of a program. So that is what they want to see. And now they have put on campaign, they have bring more vaccine to, and they have bring more strategy to be sure that every child is being immunized. So they have to look at it, how this program, how this input has been able to produce the desired output. And then at the operational level, they supervise the process of giving this immunization to these children. They make sure that all the plans are being followed. When you look at immunization program, it starts from the national, now coming to the state, from state to the local. So they monitor it at every level to be sure that all that they put in place to be sure that the desired outcome is achieved is actually achieved. What are the domains of information required in monitoring system? We talk about input and output now. In a domain of information required, we have three. That is input, resources going into conducting and carrying out the project or program. This could include staff, finance, materials, and time. Then you talk about the process. That is set of activities in which program resources like human or financial resources are used to achieve the result expected from the program, e.g. number of workshops or number of training sessions. And lastly, output, the immediate result obtained by the program through the execution of activities, e.g. number of commodities distributed, number of staff trained, number of people reached, or number of people served. So in conclusion, today we have discussed monitoring of health programs and services, purpose of monitoring, monitoring process, levels of monitoring, information required in a monitoring system, which are three. We discussed input, process, and output. So that is all we have for this week. Bye. See you next week.